Hello, and welcome to lecture number 14. We're continuing our wander through cognitive neuroscience methods. In this particular fairly brief lecture, we're going to talk about ways in which we can do some structural analysis of the brain. I'm going to focus here on CAT scans, or CT scans as they're often called, and magnetic resonance imaging. There are other structural images you might see, in particular things like angiograms, which are used to image the blood vessels of the brain, which can be very important in diagnosing stroke or other vascular disorders. We are going to focus primarily here on these structural images. There are also other structural images we'll talk about in the next lecture, or the lecture after. I think it's the lecture after, in which we will look at PET scans, which are used to image, do functional neural imaging, but also used to look at structures in the brain, in particular whether or not they might have something called beta amyloid plaque in them. So keep in mind, one thing that might be structural might be functional depending on how we use the technology. So we're going to start here with CT scans. We're going to then talk about magnetic resonance imaging, and then a specialized application of magnetic resonance imaging called diffusion tensor imaging. But let's start off with CT scans. CT scans are simply computed tomography. Sometimes they're called CAT scans for computed axial tomography. And essentially this is old school radiographs. These are standard X-ray technology, which is constructed in such a way to create a three-dimensional image of the brain or other structures. Now, much like other X-ray technology, not the best at imaging soft tissue. Certainly image soft tissue, but not as well as magnetic resonance imaging, which we'll talk about here in a moment. So primarily this is used to detect tumors and abnormalities, to look at structural problems. So for example, if you've had a head injury or a fall, we'll use a CT scan to see if there's any subdural hematoma or any sort of gross abnormality, or if you've had a seizure disorder, for example, they'll usually start with a CT scan. These are relatively inexpensive, which is one of the reasons why they're sometimes overused. There's a lot of controversy about both CT scans and MRI scans and their diagnostic utility. One of the things to keep in mind about diagnosis is only useful if it leads to a better prognosis. Now, some people like just simply knowing what might be wrong with them, but if we can't use the technology to treat someone better, then it probably shouldn't be used at all. And one of the things we're starting to see is a little bit of overuse of some of this diagnostic technology, because patients expect it, but also hospitals have to pay for these units, and so there's some question about the overall ethical practices. Something to keep in mind. In particular, CT scans. There is a great deal of controversy over the overuse of CT scans and the risk of cancer, because there's a lot of X-rays. So it's like getting 100 X-rays all at once. So a single CT scan is about 150 to 1,100 times the radiation of a single X-ray. And that's substantial, and so it's something we want to think about. Oftentimes, certainly in an emergency situation, the CT scan is obviously the go-to because it's quick, it's easy. CT scanner is probably open compared to the MRI scanner, and so it's a good choice in a lot of cases, but we want to be very careful about the number of times we might subject someone to a CT scan. So this is a great Scientific American article for you to check out. So you can just Google this Scientific American, how much CT scans increase risk of cancer, to just be a smart consumer. So these are what these scans look like. Well, this is the scanner itself. Many of you have probably been in these. Relatively easy. It's a big donut-shaped thing. You just kind of stick your head in. You don't go in very far. It's because they're not very wide. It's not like an MRI scanner where you might end up in a giant tube for some period of time, and we'll get into that here in a moment. And so we just have an X-ray source, an X-ray detector, and then this sort of circles around your head and creates a three-dimensional image, which can then be conveyed as slices. So this is what a CT scan might look like. We can look at whether or not the cerebrospinal fluid spaces are looking like they're supposed to. So we can look at the ventricles. We can also look to make sure the corpus callosum is intact, look for any structural abnormalities, subdural hematomas, brain tumor, that sort of thing. So that's what a CT scan looks like. Many of you are also probably familiar with magnetic resonance imaging, and of course this is used for more than just imaging the brain. Magnetic resonance imaging is based on nuclear magnetic resonance. One of the things to talk about with CT scans before we move on to MRI scans is essentially the way X-rays work is whatever X-rays don't travel through your tissue get blocked by your tissue, and so you can't get very fine-grained distinctions unless you use super high-frequency radiation, which would be quite damaging to the body. And so X-rays can show us some structures, and the level of detail has certainly gotten better over time because the detectors and the technology have gotten better. But for soft tissues, like the brain, magnetic resonance is much better. And again, it's based on nuclear magnetic resonance. And what we're essentially looking at are protons in hydrogen are really what we're after trying to see. Remember, we are mostly made of water, particularly the brain. But the other soft tissues in your body, like your anterior cruciate ligament in your knee or the rotator cuff in your shoulder, these are all soft tissues. And so the MRI is the best way to go with that. So an MRI unit uses a strong magnetic field along with radio frequency pulses to construct images of water density. Some images can also use different types of dyes. It's called an MRI with contrast. You can also do a CT with contrast. And those are usually very specific to the type of scan they're trying to do. So for example, I've had a couple of MRIs with contrast, one of my liver and another of my hip. And that was weird because they had to actually inject the dye right into my hip. And I don't recommend that as procedure, but that's another story for another day. So what the MRI unit does is it uses that strong magnetic field along with radio frequency pulses to construct images of water density. And so that allows us to get a pretty great look at what the brain looks like. And here's how this works. And I'm not an expert in nuclear magnetic resonance by any stretch. I'm a neuroscientist. I know how to interpret this technology far more than I understand all of its bits and pieces. Basically what we have in our normal state, protons are spinning in a rambling kind of way, random sort of way. We expose them then to a strong magnetic field, which makes them align with those magnetic poles. We then apply a radio frequency, and the axes of the protons are shifted in a very predictable manner, and these put the protons in an elevated energy state. And if you remember from basic chemistry, when you put something into an elevated energy state, what it wants to do is it wants to get rid of that energy. So it's going to give off that energy. So when the pulse is turned off, those protons will release their energy as they spin back to the orientation of the magnetic field. Okay? So basically this is stored energy. And that stored energy is then released as they snap back to be in line with the magnetic field. And that release of that energy from those radio waves is what we measure. And so those radio waves then strike a detector, and that's how we measure structures in the brain. Now, when we get to functional magnetic resonance imaging, it's a very similar principle, but instead of water, we're actually looking at oxygenated hemoglobin versus deoxygenated hemoglobin in what's called a blood oxygen level dependent measure. But we'll get to that in a couple lectures. So, based on nuclear magnetic resonance, protons and hydrogen are we did that already. MRI scans, as I was saying, provide much better diagnostic ability for soft tissues such as the brain and can show white versus gray matter because the density of water is much greater and the density of protons in particular is much greater in gray matter than white matter, and that shows up as a contrast in these scans. Now, one of the things that's important to understand is the clarity of these images. That is how far down and how precise of a spatial relationship that we can measure is dependent on the field strength of the MRI unit, which is measured in Teslas. And so when we start looking at some of these scan images, we'll start thinking about that magnetic field strength. So here we have typical hospital magnet will be about 1.5 Teslas. Sometimes if they've really spent the money, they'll have a 3 Tesla magnet. And somewhere between those two, not necessarily a factor of 1.5. But we have 1.5 Tesla, 3 Tesla, and in a very few places there are 7 Tesla magnets. These are only in research centers. It's going to be an expensive unit. It's also, we're starting to breach some levels of safety in terms of the level of the magnetic field. One of the things you have to keep in mind with a magnetic resonance imaging unit is you have to shield the unit so as to protect everything on the outside. Because it's such a strong magnetic field, lots of metal will come flying towards the magnet, which is why you have to take everything off. And some people can't get MRIs because they've had, they might have metal in them. So for example, if somebody is a welder, oftentimes they won't allow them, or any other metal worker, I should say, to have an MRI because that metal can get there. Most of those people have some levels of metal embedded in them somewhere, just from that overall practice, even from things like inhaling metal fragments. And so those metal fragments will get ripped out, and that's not something we want to do. There's been a few cases where people have had injuries in MRI units. There's an instance where a person was wheeled into the MRI unit with their oxygen tank while the unit was on, and that was unfortunate. My father was a mechanical engineer and actually had to design some of these rooms, and you have to be very careful because they can't have any ferrous metal in the room itself. So all the screws, nails, light switches, none of that can have any kind of iron-containing metal, which is possible to do, but you just have to be very cautious. So the 7T magnet is going to require quite the facility. There is actually a new magnet under development at the Neuro Spin Center outside Paris, which is 11.75 Teslas, and it weighs 132 tons. So that's quite extraordinary. But you can see, you really get down to the blood vessels and everything as you get down further into these magnets. So that's where we can look at the structures, and you can see under here the corpus callosum, the ventricles, blood vessels. You can start to see over here in the 7T magnet, and then you can actually start to see some specific tracts of neurons as well. So that gets us to diffusion tensor imaging. And this is an advanced MRI technique for measuring white matter gray volume and connectivity of brain areas. And so in addition to being able to image these structures, they can actually also determine how areas are functionally connected. I don't want to really dive into that technology too much, but you can take a look at the Human Connectome project. They actually have data sets you can actually work with, but this is a really great image, and the way these are coded have to do with if they are ascending or descending, and then also which type of information is represented here. But they're really actually quite gorgeous ways to image this kind of technology, and you can really see the way these are connected. As we start moving our way through the semester, we're going to talk about things like stress and how it affects the brain. And one of the things we'll see is that the connection between hemispheres is actually reduced in individuals who undergo a great deal of stress during neural development. So another look at kind of the kinds of analyses they're doing here is they're looking at genetic influence in language areas, or what level of connectivity across the brain might be genetic. So corpus callosum, basically that level of connectivity across the hemispheres is very genetic, except in those language areas. Frontal lobe is about 65% captured by genes. Temporal lobes only about 45%, which makes sense because the temporal lobes are very experience-based, memory-based. Visual cortex, very genetic. They do establish them, that is established throughout experience as well, so we wouldn't expect them to be entirely the same. And then about 85% genetic in the connectivity across hemispheres for visual spatial skills. So a lot of really interesting work being done in this area. So that's a quick introduction to structural imaging. The next lecture, we're going to be looking at electrical activity in the brain and how we measure that. And then after that, we'll get into functional neural imaging in a set of lectures coming up.